I previously had a breast uplift and areola reduction with another clinic in March 2021, but I am not happy. Would you offer areola reduction? Yeah, yeah. Definitely. I mean, March 2021, a few years ago, isn't it? I mean, what I was going to say is it's always best to go with the original surgeon, original clinic, because they might have a kind of incentive to do it for, not charge you full price for it. Whereas, we would charge you full price for it, but it's been a few years ago, so they might still charge full price. But yeah, for sure. And it's the reason I say that is because it's a risk with areola reduction that it can stretch out. Now, having said that, if you have a breast uplift with areola reduction, the risk is less than if you're just having an areola reduction, because if you're having a breast uplift, that removes quite a lot of skin, including the extra areola skin, but also some skin surrounding it to tighten the skin of the breast. So the tension is kind of distributed a bit more than if you're just having an areola reduction, which is just a scar around the areola, which is all the tension is around that areola scar. So the risk of stretch is more with an areola reduction than it is with a breast lift. So not that I want to kind of put you off, but when we do the areola reduction, there's different sort of stitches you can use when you do an areola reduction. So personally, I tend to use a permanent suture as we call it a purse string. It's kind of call it a wagon wheel design, but anyway, it's a stitch that goes all around the areola to take the tension off. We put it down deep, and that permanent suture makes it less likely to recur, because recurrence is a risk with areola reduction. It can stretch out because it's closed under tension, and there's a risk that it can stretch again. So that's always a risk, but we try and reduce that risk as much as we can. As I say, I use a permanent purse string suture to try and reduce that risk, but even so, there's always a risk of stretch with that. But I don't want to put. I'm not doing. Having said that, I don't. Yeah, the answer is yes. We would be happy to see you and offer another areola reduction for you. Absolutely delighted to see you.